Bismillahirrahmanirrahim. I'm again Dr. Ghulam. My name is Dr. Ghulam. We are here in Pakistan. Today is 16 September 2020. Here in Pakistan, the time is 5:25 p.m. I'm a cardiologist. Let's see why we are suffering of health problems due to mistake of the human beings. Actually, I will be very fast because the time is here. I'm at my clinic. There was special diet from the guard that was called Mansalwa, then refused by some ethnicity. The guard banned, and then the guard said one can eat all the things except pork, and when there is no Allah Akbar in the flowing blood. So one refused, then the guard banned the fats in Torah and in the Quran. You can eat only the fats which is attached to the fats and bones. And then there were aswabika. When they go to the cave, they were stayed here for more than 309 years, and they were sleeping. And as in mentioned in Quran, Surah Kaf, ayat number verses number 17, the cave, two holes, one towards the south and the other towards the north, and there was no direct sunrays on the skin of Aswabika. And when some male walking, the area below this mulus area should be exposed in the male, this area. If their skin is not exposed, that will be not good Jannat. So when the human beings is born anywhere in the world, and all the mother, when they are born with vitamin deficient, 60% hospital delivery or C-section. When anyone is born at home or in hospital, the mother milk is deficient with bone vitamin and magnesium. So the baby should be loaded with 2 lakh units of bone vitamin. Even after 5 months, the skin of the lower limb should be exposed 5 inches to the sunlight, which will be raised, and 10 months 10 inch up to 10 months up to 3 years, and after 3 years the whole body should be exposed to sunlight directly. So as we are human beings, the skin should not be exposed in the public spaces, but some female can expose the skin of the lower limbs and arm at home to the sunlight. So actually in the skin there is epidermis layer, which contains again 2 layers, spongiosum and basal layer. Because today I will be share very important unique case, very important. So you will be trying to listen this video up to the end. So when the sunlight hit the skin, in the skin there is 7-dihydrocholesterol. So when the virus hit the skin, this 7-dihydrocholesterol is changed to pre-vitamin D3 and the liver. Then from the epidermis come to the liver, and there is first hydroxylations, and that is D1 and D2, and the kidney second hydroxylation, they making the active bone vitamin, and then come to the small intestine. So when the sunlight is not hit the skin, that 7-dihydrocholesterol exchange to cholesterol, and they lead to hyperlipidemia, and everyone know the consequences of hyperlipidemia. And when the bone vitamin come to the intestine, they absorb the calcium part of the bones and teeth, and they absorb the magnesium. The magnesium deficiency lead to sweating, slivation in the fetus, especially autism, depressions, and tachycardia, sinus tachycardia, in burning souls, and sweating in Lassa, decrease hearing as the ossicles, cochlear nerve become weak, and the vestibular nerve become weak, so lead to vertigo, not dizziness, and depressions, and obsessive compulsive syndrome, and loss of memory, and early widening of the hair fall, and decreased libido, and obsessive compulsive syndrome, and mood disturbance, and they're especially sweating. And in the presence of proper vitamin D, the zinc is properly used in the body, so they're making the immune system. So the immune system become weak, so are facing up tuberculosis and different infections and some allergies, and the autoimmune system is stimulated, so lead to some autoimmune diseases like tuberculosis and hashimoto-thyroiditis, and some carcinomas is very known as CF colon and prostate malignancy, ovarian tumors, and there is also a lot of other health problems. When the bone vitamin become deficient, the parathyroid hormone now is increased in response to the hypovitaminosis D. And that parathyroid hormone, which is called thief of the bones, are the rat which is eating the roots of the tree. Now that parathyroid hormone now will be do something for the body to produce the calcium. So the bone is the easy source in the human beings and the animals. So they remove the calcium from the bones. So the bones has become weak. So we are suffering of rickets and fractures and early vertebrae involvement. They lead to back pain and joints pain and teeth problems, and the ossicles become weak in the here. So the hearing is decreased early in short stature. As a parathyroid hormone increase secondary to hypovitaminosis D, secondary hyperparathyroidism, there is increased excretion of the calcium from the renal tubules. So there is renal stones. As everyone know, in the bone density, if someone is okay up to 16 years, then the bone density start to decrease, 1% in the male and 6% in the females. And up to 30, at the age of 30, 12% bone density is lost in the male and 30%, 26% in the female. Anyhow, some people in the world even using steroid for some asthmatic people, some allergies, and when the disease increase, one should be given steroid, because steroid is called enemy of the bone. So I think we don't think on the corona, because the white luminous circle around the sun is called corona. So no one is asked in the world, are you using direct sunlight on the skin? Anyone ask from the patient? Even in Canada, in America, anywhere in the world. We are here in Temargara, lower the KPK. KPK is the province of beautiful Pakistan. My name is Dr.Ghulam Farooq. I'm a cardiologist. Anyone can ask, what is your vitamin D level? I think no one is asked. So I think the top health problems in the world, and the new statistic in 2020, that is cardiovascular syndromes, cardiovascular disease, and the first is osteoporosis. So premature osteoporosis, but no one is thinking why the sun is rising from the east and they're going to the west. And that was the Fenson who are treated the lupus vulgaris with phototherapy. If someone is remember who are awarded Nobel Prize, and someone invented the vitamin D. I'm sorry, I don't remember the name now on the spot. And when they given butter to the rats, the rat before giving butter, they were weak in vision and they were weak as a whole. So the rat become healthy in the vision, improve when they heated the butter and again given to the rats vision decrease and they become remain healthy. So their label is bone vitamin, sunshine vitamin. Anyhow, so far except God, no one know what is the thing in the skin when the skin directly hit by the ultraviolet B rays, and that is converted to pre-vitamin D3, and then second process, and then in the kidney active vitamin D. So 7-dihydrocholesterol converted to cholecalciferol. So I think we need all human beings, including some plants and animals, we need direct sunlight on the skin along with fats and diet for a healthy life up to 60 years. So I'm here to share one case. Is very important case. This is a male baby which I have seen at Temargara Hospital free of cost. This is Temargara. The baby was from Swat, and at that time, that was 12/6/2019. At their level, the level of bone vitamin just 2.5. Then again the patient lost the record, and we again checked at the hospital, because we in Temargara Hospital everything is according to the international guideline. When they tested the level of D and lipid profile from Aga Khan, the level of bone vitamin just was some 17. Then again when I have checked my clinic free, that was the time, look at this, that was this date, the level of D just was 22 and the cholesterol was this. So today the patient is again come at my clinic after 1 year, and this is the thus. Now the baby is more than 11 years and unable to stand. So anyhow, before that, today is the level of these again 19. That should be not less than 75. And the look at the level of cholesterol, that is 138, because you use sunlight. And H. pylori is reactive hemoglobin is this. But I am here interested because this was, like, say, 1 year back. Look at the right knee joint. There was no fusion. Look at this. Look at this. Today I am very disheartened because he is my patient in hospital or private setup, no problem. But I have lost this joint. Look at the right knee joints. Look at the femur. Now they're touching the tibia. So that is fusion. So this is fusion. Look at these bones. Yes, look. So I think this is the right knee joints, and this is the this joint. So anyhow, I think if someone not to accept the advice of a doctor, I think this is the mistake of the doctor, because I may be deficient in counseling. But I'm sure why before 1 year there was no fusion of the humerus with the tibia. Now this, look at this, and look at this lateral view. So there's now no treatment for such joints because that is pre-osteoarthritis, which is the cartilage is lost, the menisci is lost, the cartilage is lost, the capsule is lost. Look at this. This is just 11 years old. So what to do with these health problems? Because Pakistan is a sanctuary country. So my message to all the world, because we should be not to consider heart attack, joint pain, etc. This should be just the disc health problems, which is mostly 80% health problems occurring due to not using direct sunlight on the skin. 80% health problems in the world is due to not using direct sunlight on the skin, not the mistake of the God. Because the God is the same, the earth is the same, sunlight is the same. Why there were no cardiovascular diseases too much before 1930? And why these cardiovascular diseases not decreasing in the world? So as an update, because there is the top cardio health problem in the world is coronary syndrome, acute or chronic, and the second is premature osteoporosis. So one day I am sure we will be notice this world, the people should be using direct sunlight on the skin along with to check the cholesterol, because the substrate in the skin is cholesterol to convert to cholecalciferol. So I think we should be invited the people which is living outside Pakistan to come to Pakistan, because Pakistan is very safe countries and our sunlight is so safe because they not make no risk of malignancy. Because here I am to, if someone is asked any question, should be appreciated, but that question should be with evidence. And why our people using, why the people throughout the world using a lot of medicine, and even with medicine not stable? Why they not normal without medicine? Anything wrong? Yes, okay, the coronary artery become blocked and CVA and osteoarthritis, while the other people using painkillers. Why they using antidepressant? Why we not love one another? Why we not the same human being throughout on the earth? Because the earth is the same. Why there is different health problems in other countries, different in other countries? What is wrong? Because earth is the same, diet is the same. What is wrong? I think these are very good questions. These are my questions which I am putting for the audience to answer me. So if anyone can record any case of cardiovascular diseases like heart attack and peripheral vascular disease and carotid disease and severe before pain in the joints and back, can report to me. That will be appreciated. So at the end of this world, one day the sun will be arise suddenly from the west, and they will be from north, not from the east. That will be the last day of this world. That will be the end of this world. So there, every human being should be answered to the God, as the God says, human That is your responsibility, because you are because the Broca's areas in the brain is to think why we have health problems, which is not from the gut just due to human mistake. If that is Europe, if that is North America, if that is Pakistan, anywhere in the corner of the world, so we love to another. Because look at the corona pandemic, because if look at the bemistry, black Asian minor ethnicity, they were all deficient with bone vitamin, and so the anyhow, we don't think why there is sunlight, why what is the B rays, be the best, A, why it should be not used in the morning because the frequency is high. Don't think what is corona. Okay, thank you. I am very disturbed because my patient is lost the right knee joints. Okay, thank you. Because the age is 17 and the SWAT area is starting from the S, so there is very good sunlight. I'm doing this awareness program for the last of more than 6 years in but what can I do? I am anyhow, there is very good suggestion, and even on some hospital now we are giving bone vitamin to all the patients, so we are very thankful to Health Department of Pakistan. Okay, thank you. Assalamu alaikum. These are this is me, and this is the president of College of Physician and Surgeon Pakistan. So unfortunately we don't think why we suffering of heart attack, some malignancy in back pain before after starting pain in the bodies, because pain, for all pains, I think we need sunlight. Okay, thank you. Assalamu alaikum.